wanted to ask you first, you had tweeted today, you said you were pro-vaccine and anti-mandate. Can you explain what you meant by that?
Look, I think it's just the normal public health policy that we've lived with in America forever until the year 2020, which is, look, the role of government is to help get the vaccines coming. Okay, we did an amazing job of that with Operation Warp Speed. We should encourage vaccine use. Okay, it's safe, it's effective. It's widely known that you're not going to go to the hospital if you've been vaccinated. Doesn't mean you can't get it, but nobody ever said you couldn't get it. You're not going to be super symptomatic. You're not going to be in the hospital. You should get a vaccine, but I'm not going to force you to get a vaccine. Okay, that's the other side of this, and that should be a very easy thing to come to agreement on in a liberalized society like ours.
And just to be clear for our viewers, you yourself have gotten the vaccine as well?
Yeah, like I said, safe and effective.
And when you say anti-mandate, are you talking just at the federal level, like with the VA, or do you mean at all levels, state and local as well?
Frankly, I think all levels. I do not think that people should be forced to take a vaccine at their place of work, at the federal level, state level. I don't think that's okay. Okay. Now look, in the military, we make people take vaccines. Okay. But those vaccines have gone through years and years of longitudinal studies. And look, I do happen to think that this vaccine for COVID is safe, but it should go through the same process that all other vaccines have gone through before you absolutely mandate it and you threaten to fire people if they don't take it. Okay, again, you can't control people to the extent that a lot of my Democrat colleagues want to. It's not right. It's very un-American, and it's okay to live with that minimal amount of risk. You can't reduce all risk to zero. That is not a tenet of a free society.
And when you say getting the vaccines to a certain point, you mean FDA approval, right? Once it gets vetted and it gets the FDA approval, that's when.
Right. Right. But even then, again, like, then it should be along the same lines as any other vaccine. We don't mandate vaccines, though. Okay, throughout our life, it basically anywhere except for the military. So why this is different all of a sudden is beyond me.
And Congressman, President Biden had talked about using a strategy of volunteers, faith leaders, medical professionals, community organizations to canvass neighborhoods to try to get more people to get the vaccine. I was curious to get your thoughts on that strategy.
It seems to be backfiring. The problem is that public health officials have lost so much trust. So, listen, if that hadn't happened, you wouldn't see me having a problem with trying to promote the material, trying to promote the science. But people feel like they've been lied to because they have been lied to multiple times. I mean, look, this mask mandate from the CDC yesterday, where vaccinated people should wear masks, that's completely anti-science. And by the way, they're basing it off of one study from India that yesterday was pulled because of peer review. Like that's how bad the science is on this stuff. People know it. People have common sense. They know that if they're vaccinated, they shouldn't have to be wearing a mask. It's kind of the whole point of getting vaccinated, right? Because we can get back to normal life. So they've lost so much trust. And I think that's why you're seeing the pushback that you're seeing. People don't want their doors knocked on. They don't want to be pressured into it. It feels like a slippery slope to people. And look, you have to be living under a rock not to know that there's a vaccine available. There's not a problem with people not knowing there's a vaccine available. There's vaccine hesitancy because we live in a free country, and there's always going to be that. Just accept it.
Yeah, because the health leaders have talked about one of the big obstacles to overcoming vaccine hesitancy, or one of the strategies to overcoming, I should say, is to hear from those trusted leaders, right? Your friends, your neighbors, your faith leaders. Is there a better way to do that, or do you just believe that shouldn't even be part of it? There's just a better strategy to getting more people vaccinated?
We just keep putting out the science and the studies and the stats that show, look, 99%, well over 99% of people who are in the hospital right now are unvaccinated. Just tell people that. Do it kindly. Like, we need to stop forcing it on people. They're reacting in the way that you don't want them to. And then everybody starts pitting each other against one another, right? It becomes this sort of pariah mentality where if you're unvaccinated, you're somehow a dirty person. This has gone way too far. So again, too many leaders have lost way too much trust on this.
At the federal level, can you talk about what Congress is doing to not only combat the coronavirus, but also maybe to increase access to vaccines in places like Houston?
I find it really hard to believe that people don't have an access to the vaccine at this point. I think we've done everything we need to do. It's extremely easy to get to the vaccine. And I haven't heard otherwise.
I guess what else can Congress do on the issue of COVID in general? And especially with Democrats and Republicans being at odds on a lot of things, is there somewhere where you do see common ground that you can move forward?
The Democrats up here have a complete refusal to engage in any common ground thinking, right? They're engaging in punitive measures up here on the Hill, making us wear masks now, having us go through metal detectors, just out of pure malice. So there's no space for bipartisanship up here anymore, and that's 100% on the Democrat leadership, 100%. Like a lot of us have really had it with this. So what can Congress do to get America back on track? Leave America alone, for one thing. All right, let people get back to work, stop paying people to stay at home, let our economy get back on track. It's heartbreaking to hear from so many small businesses that are threatening to fail because they can't hire enough people. People won't even take $30 an hour jobs. I mean, our economy is not going to recover. Our supply chains are not going to recover if we can't get people back to work. People's skills will deteriorate. Their resumes deteriorate, right? And then we're not going to have a solid workforce, and we will be in a very bad period of slow growth economics, just like what happened after the 2008 financial crisis. We were doing pretty well. A lot of people don't realize this, but wealth, even for the bottom quintile of earners in America, increased pretty dramatically, even in the year 2020. It's now standing still because businesses don't want to invest because they're afraid Joe Biden will regulate them out of existence. So they're not investing. They're not sure if there's going to be a tax increase because Democrats keep saying there's going to be a tax increase, and they can't get workers because Democrats keep paying people to stay at home. So as usual, the government is your problem. The government is 100% your problem right now. And my goal is to leave you alone and let you live your life, because Americans are pretty good at being prosperous when they're allowed to live their lives.
And on the economy, with the Delta variant spreading now at a quicker rate than the original virus, and the cases and the hospitalizations increasing, how concerned are you about things sliding back to where they were in 2020? How bad do you think this could get?
Right. So unlike the CDC, I do listen to the science. Again, the CDC is relying on data that's been debunked and lost and failed the peer review process. It's astonishing, frankly. So the truth is the Delta variant is very contagious. It's also much less severe. So we have less than 30 new death rate in Texas every day. Keep in mind in 2020, we're in the hundreds every single day. Look, if you're vaccinated, you're not going to need to be hospitalized. Our ICU capacity is normal right now. And, so look, you got to take precautions based on your own health factors and your own risk assessment. I will continue to say that. I think you should get the vaccine, okay? But I also think you should live your life normally. And look, we always live with risk. And we're at the point now where the Delta variant is much more similar to the flu than the original COVID variants.
And to close, Congressman, one more question I wanted to ask about your health. Obviously, we all heard about what happened with retinal detachment and vision loss. I just wanted to ask how you're doing, how you're feeling, and how your vision's recovered.
I appreciate that. Feeling good. Back to my normal. My normal is very complicated when it comes to vision, but I got real lucky. Great doctors in Houston, as we all know, and it was a pretty serious surgery. It took quite a bit to recover. They really tore apart my eye to fix it, as sometimes happens with surgery. Sometimes with retina detachments, we'll just laser it down. So they had to laser mine down, but also put a buckle around it, which is a whole, boy, if you look this up on YouTube, I'll tell you what, maybe you shouldn't. It's a lot. But I'm very, very lucky and blessed to see basically my normal.
That's great to hear. And as far as your workload, are you 100% back at your previous kind of work level, work intensity, or are you still kind of dialing things back a little bit?
We've been probably about 200% for the last month or so. Gotta have a talk with my scheduler because we missed out so much in those couple of months. So yeah, not 100%, but more like 150, 200%. and I'm looking forward to August recess, which isn't really a recess at all. It just means work not in DC. So, yeah, we're really back at it. We're doing everything.
Well, I appreciate you fitting us into your busy schedule today. Always good to see you, Congressman.
Great to see you. Thanks.
As well. Take care.